cysts. And I will focus on pulmonary and extrapulmonary findings, which is exciting. And disclosure, I have nothing to disclose financially. I used image from my collection, colleagues. I took a lot of informative images from literature I revised it. So these are the disclosure I have. The outline in this CME will review various presentation of thoracic hydatid cysts. We'll start with pulmonary and extrapulmonary hydatid. We shall cover cardiac, thoracic, and the soft tissue of thoracic, diaphragm, pleura, mediastinal. We will cover each part of the chest, so that you will have some differential diagnosis whenever you get something in the chest. So this is the outline. We'll revise also various radiological signs. We'll start from simple uncomplicated hydatid cyst of the lung, and we'll go to a typical imaging manifestation of the disease. So these are, at the end, radiologists should be familiar with the spectrum of the imaging finding in thoracic hydatid cysts and have new thinking about differential diagnosis of hydatid whenever he's encountered with chest mass. So introduction. As you know, human Echinococcus granulosa is responsible for the most common type of hydatid disease in the world. History showed that hydatid cyst has been living with human for the last 2,000 years because it was it's found in mummies in human specimen. And Rodolphi in 1808, he is the first person who used hydatid as a name to describe Echinococcus. Hydatid in a Greek literally means watery vesicle. As you know, the liver is the most common site of infection. It accounts for 60 to 70%, followed by the lung in 15–25% of the cases, and other sites like spleen, kidney, brain, bone in about 10%. I like the following saying: any part of the body except our hair, teeth, and the fingernails are exempted from the hydatid. Every part of the body, starting from any part of the body, can be affected by the hydatid. So any swelling in the body, we should think of hydatid in endemic areas, especially. Simultaneously, lung and the liver cysts are observed in less than 10%. Pulmonary hydatid are mainly located in the lower lobes, and it's account for 55 to 70%. There may be multiple. Introduction. Lung parenchyma is the most common site within the thorax. Hydatid cyst may develop in any extrapulmonary region, including pleural cavity, fissure, mediastinal, heart, vascular structures, chest wall, and the diaphragm. We will cover each. I have example image to show you in each part. Imaging plays a pivotal role in diagnosis, not only in diagnosis but also in visualization of extent of involvement and complications associated with the hydatid cyst. The classic imaging finding of liver is known, well known. Finding of thoracic hydatid, however, extrapulmonary locations have been less clear and confusing, and usually it is diagnostic challenge. Pathology, how hydatid cyst of the lung acquired is thoracic involvement may be occurred via diaphragmatic routes. These are the percentage direct from the liver to the diaphragm, from the liver through the diaphragm to the lung, account for this percent. by means of hematogenous also contribute some percentage. Compressible organs like lung, brain, any compressible organs facilitate the growth of cysts, and this has been proposed as a reason for high prevalence of disease in children. So the lung is compressible in the children more than adults, so that's why a child will have more Hydatid cyst. Hydatid cyst has 3 layers. The first is pericysts, which is a layer derived from compressed host tissue and the chronic inflammation. Let me have a diagram. This is the outer cyst, the host-derived collagen layers. It's made by the host, and the proper hydatid cyst has 2 layers, and it's endocyst in these are the internal part where daughters are existing. The other one is laminated layer, which is acellular. There is no cell inside; it is only connective tissue. So these are the 3 layers. The first layer, which is defense made by hosts. So these are the 3 layers. These are life cycles. This to touch. Sheep is a definite host, and the dog is a definite, sorry, and that is intermediate host. Human being become intermediate host by accident. So if you are a housewife or retired who had a dog, the dog was not treated very well. If you have a relative with a dog and have equinococcus granulosus, these are the risk factors. Human being gets by Dr. Marta, please.
Okay, sorry.
Mute our grass. So hand to mouth, when the dog lay or defecate somewhere, these are where the sheep will get the eggs, so it will be grown in the egg. The egg will become part of the meat, so the dog will eat. These are the normal cycle, but incidentally, human being can interfere and can get infected with this. Clinical presentation: uncomplicated hydatid cyst of the lung are usually asymptomatic. When it is complicated cyst, the symptoms are non-specific, like coughing, chest pain, fever, and hemoptysis. When pulmonary hydatid cyst rupture and communicate with bronchioles, patients are described to cough, sometimes like grape-like material, which will be described as a patient. Imaging thus play a pivotal role in the diagnosis of the disease. Although typical imaging findings have been well described in the literature, the radiologist should also be aware of atypical imaging findings that can occur secondary to complications. Imaging of thoracic hydatid, chest X-ray, chest CT, ultrasound, and MRI are the usual imaging modality used. X-ray is primary and commonly used. It cannot assess complications fully, and so you need the other modalities. Ultrasound can show hydatid cysts located in the diaphragm, periphery of the lung, and pleura. So you can use ultrasound to localize. If you first localize with chest X-ray, if you thought that the hydatid cyst located in the periphery of the lung, you can assess with ultrasound, like you are assessing the liver. Transthoracic echocardiography, however, can demonstrate hydatid cyst located in the heart chambers. CT in the MRI can demonstrate features, complications, and extension of hydatid cells in detail. CT in the MRI also assess treatment response. Chest X-ray note. Contrast CT necessary to extrapulmonary hydatid cyst, like mediastinal or if the cyst is located around the great vessels, you should use contrast CT. Radiography uncomplicated hydatid cyst appears as a well-defined homogeneous radio opacity in the chest X-ray. However, sometimes differential diagnosis can include fluid-filled cysts, benign tumors, carcinoma, metastasis, and inflammatory masses shall be considered. And you should aware of where the epidemiology of the disease. In pastoralist area, you should highly, you should think of hydatid cyst whenever you get some round cyst in the lung. The appearance of hydatid cyst has been compared to common cannonball on anteposterior projection and rugby ball on lateral projections. So let's see some of the example I have here. You can see this is conventional X-ray. There is a round, well-defined right lower lung zone opacity. You can mention some of differential diagnosis depending on if it's a young child with pastoralized area like where arbotarder is common, and if they have dogs around, you should think of anything if incidentally find such a thing. This is a colored X-ray, showed a little bit more in a beautiful manner. When you have here, you can see right lower is the same area, because I said lung hydatid is common in the right lower lobe, and you can see well-defined cysts, well-defined cyst, which is a round PA projection and rugby ball type in the lateral projection. This is associated calcification. There are multiple small cysts in the lung, left upper lung field, and liver probably with calcification. So X-ray, uncomplicated cyst can give you a lot of information. This is where we end up in a problem. Frontal chest X-ray can give you a mass like this. This X-ray belongs to one of the gentlemen, and they had a big mass in the around hilar region. So you should have, there is another adjacent cyst. So it at least, I know it has, this person has two cysts, one big, one small, but one cannot say this is from the beginning using this radiograph, this is hydatid cyst. There are a lot of differential diagnoses you should mention on this aspect. So this is also hilar, the same smaller one. You can see over the sign showing that there is a vessels can be seen through the mass and well defined. A lot of differential diagnosis can be mentioned, starting from bronchogenic cyst, pericardial cyst, mass, lymphadenopathy, and so on. So vascular anomalies can be differential diagnosis. Here is a huge one. We have a big right, almost right hemithorax mass, and pushing the heart to the left. It's so difficult to consider in the first instance using X-ray. Ultrasound can give you some clue on this if you do ultrasound. The differential diagnosis can be mediastinal mass, right upper lobe mass, and right extensive consolidation, right upper lobe and right middle lobe, extensive consolidation. Loculated fusion can be considered as a mass, but for this is the area where you should have CT, because CT is indicated if you suspect of a huge, big mass equivocal with cyst. So CT of this patient was done, and now you can see the radiograph showed the same, and non-contrast enhanced CT showed huge right upper lobe mass pushing the heart to the left. So this is uncomplicated. It belongs to 13 years old who has gradual and progressive dyspnea. Initially was dry cough, but start to produce blood stained sputum when the disease is not ruptured, it is contained or unruptured, uncomplicated hydatid cyst. Without CT, you cannot diagnose here, but ultrasound could help you. Here is another well-defined mass in both lungs demonstrated on radiography and the CT. So the CT showed there is a mass, the equivalent mass on the left upper lobe, right lower lobe, with well-defined cyst is fluid attenuating contents. This is another colored X-ray, showed multiple lung masses. For this, one of the indication is having a lot of lung masses or lung nodules. You should have CT on this patient. Another one is X-ray can show you complicated hydatid cyst too. There is a crescent sign on this patient, so you should have CT on this. I don't have CT of this patient. Should have CT. There is radiography can also show you complicated cysts like water lily sign, in which the contents of the hydatid is expelled, and you can see floating, and there is associated pleural fusion as well as lung consolidation. CT and MRI indications, however, are for suspected complications when the equivocal, when the number is too much, when the size of the cyst is very big, when the cysts are near vital structures like hearts and great vessels, if surgery is contemplated, and also following treatment. So radiological manifestation of pulmonary hydatid, variable depending on the presence of complications. If it is with no complications, there is no symptoms, or there is no complications you can see on the CT or chest X-ray. They can be classified as uncomplicated and complicated. Complicated one can be divided into contained, completed, and superinfection. These are depicted clearly here. You have uncomplicated cyst, in which you have a smooth wall. You can see the outer cyst. In the lungs, the calcification is very rare, so complicated cyst can be ruptured, can be infected. Ruptured one can be contained. It's ruptured but it's contained. Rupture can be completed. When it's completed, you have combo sign. We'll see each of them. Water lily sign, mass within cavity sign, dry sign. When it's infected, you can see ring enhancements, air bubble, or air fluid sign. When there is associated, always the hydatid cyst cause complications, so you can get atelectasis, you can get bronchiectasis, you can get reactive mediastinal lymphadenopathy, you can get pleural thickening, you can get pleural fusion. These are the Let's see uncomplicated, that is cysts in CT. You can see right lower lobe, homogeneous, slightly enhancing rim with water density cysts, oval shaped. Here is another with well-defined in the left upper lobe. These are uncomplicated. Hydatid cyst has well-defined homogeneous lesions, smooth wall of various thickness, fluid density measurement on CT. Central located cysts are usually round, and the peripheral oval shaped. Daughter cysts and calcification are very rare in lung. It's common in. These are uncomplicated cysts showed right lower, and there is associated liver cyst also. Probably is direct migration of cyst from the liver. You can see also uncomplicated cysts in this axial picture of the patient lung window. You can see small cysts, which can be differential diagnosis, can be metastasis, any nodule, and you can mention it. Complicated Hydatid is defined as rupture and or infected. Your complicated cyst, if it is ruptured, we say complicated cyst. If it is ruptured, if it is infected, we can call it. Rupture can be classified as contained in the complete rupture. Why rupture? The rupture, there are theories. The more the age, the cyst in the body, the likelihood there will be rupture. So there is no conservative treatment for Hydatid cyst in the body. So as age of the cyst become older, the cyst will rupture. If the size is so big, the cyst will rupture again. There is another factors of host factors, and anti-elements people are taking will also cause rupture. The rupture is inevitable, so the patient should be treated whatever it is, whether if they have Hydatid cyst. Contained rupture is described as a detachment of pericyst from endocyst. As the cyst contents are surrounded by the pericyst, a contained rupture is unlikely to develop as an allergic reaction or infection. So there is no allergy to contained rupture. So the fluid didn't go to systemic circulation, so there is no allergic reaction. So these are some of the contained rupture. So here we can see there is a well-defined cyst with the so-called air crescent sign or meniscus sign. A thin crescent of air is seen between this is pericyst made by hosts, with this gentleman, and endocyst when due to bronchial erosion. The second sign is inverse crescent, the inversion of this sign, so you can get air posterior aspect of lesion created by dissection through the posterior side of the membrane, so you can get, this is the so-called inverse crescent sign. The third one is signet ring or air bubble sign. This shows imminent rupture, and that's very important sign to alert the physician. There is associated pleural thickening, probably slight pleural effusion on this patient. Complete rupture has its own sign, is defined as a presence of sign of connection with bronchus at that time. And you can see radiological finding of complete rupture can be listed as follow. Here is a combo sign. Another name is double arc or onion peel sign, in which the air go between pericyst and endocyst, and as well as the membrane inside the cavity. So there is we call this one combo. The other one is mass within a cavity sign, where some of the contents of the hydatid cyst is evacuated. You can see a small mass remaining, so we call mass with a cavity sign. Water release sign is a famous sign, you know it. So this one is ring sun. It's not common. You can get rising sun sign. The other one is dry cyst sign, where all contents has been expelled. The patient will have empty cyst sign or dry. They call it dry because there is no content of cyst. Superinfection is the most common complication of a ruptured hydatid cyst. The most time the patient comes to the hospital due to infection. So incidentally, the patient might be diagnosed as hydatid cyst, but usually presentation of the patient is superinfection of the cysts, and so that they will seek medical help in medical centers. So it's a common rupture. Superinfection of hydatid cyst can show high, how to differentiate is high hospital units, and cannot be differentiated from pyogenic abscess. Remember this. So you cannot diagnose or differentiate from lung abscesses. Sign of cyst infection are ring enhancement sign, in which you can see enhanced ring, so, the sac, the content has gone, so there is inflammation of the wall. We call it ring enhancement sign, air bubble sign, and air flow level. You can see. So there is associated collapse consolidation, and you can see also lymphadenopathy on this patient. So this patient he has superinfection of the cysts. Some cases, this is 51 years old patient, loss of appetite, chest pain, shortness of breath of 4 years duration. She has ruptured huge hydatid cyst on the left, and she has collapse consolidation, she had full level, so teak enhancing ring sign. There is an extra, there is pleural fusion and pleural thickening, so this is a patient who is complicated. There is another small, partially ruptured cysts on this patient. This is our case. This is the same case here. You can see there is a huge airflow level with floating membrane. You can see enhancing, and there is another collection of fluid here, fluid level. So this patient developed pleural fistula and cystopleural fistula, cyst bronchofistula. It has a lot of fistulas communication. This is our case. This is another complicated cyst with a bubble sign. Whenever we see this one, this is imminent rupture. The other one is, it's from literature. You can see the round membranes, the so-called serpent sign, in which the content, the fluid has been expelled, but the membranes in the bottom of the cyst is associated consolidations and probably pneumothorax. Here is another patient showing ill-defined wall with small air focus and consolidation in adjacent lung parenchyma. These are the patient with complicated hydatid, with consolidation, bilateral pleural fusion. This patient definitely present with high-grade fever, chest pain, which confused with other like a simple pneumonia, community-acquired pneumonia, but when CT could help, could solve the problem. Is another case with serpentine. You can see consolidations, you can see air, you can see dilated thickened airways, bronchiectasis, and pleural effusion. Another case, the same. You can see also not only lung, but cardiac hydatid cysts can be seen. Pulmonary vessels can be also involved. The heart is unusual location for hydatid cyst with incidence of very low, maximum 2%, may occur because of hematogenous pleural or rupture of lung hydatid cyst. The most common collocation of cardiac involvement in decreasing orders are left ventricle, 50%. If the heart is involved, 50% left ventricle, pericardium, interventricular septum is the second most, right ventricle, pericardium the third, fourth, and atrium, both atria contribute to 5 to 8%. So echo can help you in diagnosis. This, if you encounter with this huge cardiomegaly, very difficult to suspect, but the patient persisted to have pain, and but there is no sign of congestive heart failure. The lung is clear. The mediastinum is normal. This patient sent for echo, and the suspected. Then the next step was they went to send to CT. So you can see the what's echo finding honeycombing in the heart. You see in the it's huge multi-cystic cyst in the right ventricle, and the CT of the same patient on the left side, you can see huge CT showed huge left ventricular hydatid cyst with calcifications. So is a left ventricle is the commonest site for involvement. Here you can see there is also left ventricular hydatid with well-defined border. There's associated lung hydatid, and you can see also left ventricular hydatid. So it's common to have. So not only cardiac masses, but also in our context, you should think of hydatid cysts as differential diagnosis for any cardiac left ventricular mass. Here is a CT, the MRI showing cystic mass within multiple septa and the calcification in apex of the heart with bulging in pericardium. You can see fluid associated with inflammatory conditions. Here you can see also the same left ventricular. One can suspect an ventricular aneurysm, but you can see the septum, so you can also put differential diagnosis in endemic area as hydatid cyst. Here I want to show you occasional cyst can directly extend into pulmonary artery. You can see the main left pulmonary artery has hypodense mass with membrane. You can see there is an associated extension to pulmonary artery branch. You can see them. And here also extension of hydatid membrane to the right descending pulmonary artery. He has lung hydatid cyst too. Here are the, also you can see extensive involvement of hydatid cyst. You can see the wall of the cyst, the membrane. That's why you are suspecting. This is a differential diagnosis. This is not hydatid cyst, but pulmonary sarcoma is having the same distribution, and you can have here, if you measure the density, you get water density. Here you can get the soft tissue density. So there's a difference between the pulmonary sarcoma and the other one is PTE, can be confused with it. So whenever you have PTE in a, you can notice density is higher here, constant here, and very low here. So these are some of the differential diagnosis. Aorta can be also exceptionally involved, even though it's rare, but in such a cases, pseudo aneurysm can develop. You can see wall erosion and can be seen on CT. There is a hydatid cyst is located here. It invades the aortic wall and creates erosion of. So it can be dissection, can be as differential diagnosis. So hydatid cyst can sometimes confuse us, or it's a diagnostic challenge.
Sorry, Dr. Amir Handil Akwaratano.
Actually.
Unfortunately, this Zoom link created by the IT person can tolerate only 100 individuals. ስለዚህ እስቲ እባካችሁ ተማሪዎች በተለይ አርዋን አርቱ ላይ ያላችሁ ተማሪዎች ውጭ ያሉት ብዙ ጆይን ማድረግ የሚፈልጉ ሬዲዮሎጂስቶች አሉ ሲዩ ስለሚያስፈልጋቸው በጣም ብትተባበሯቸው ለጊዜው ከዛ በኋላ ላለው ለሚቀጥለው እናስተካክላለን በጣም ይቅርታ ተማሪዎች የምትችሉ ከሆነ ውጭ ያሉ ሬዲዮሎጂስት ሲፒዲው በጣም የሚያስፈልጋቸው መግባት የተቸገሩ አሉ ይሄኛው ዙም ሊንክ ከመቶ በላይ አይችልም እና ፕሊስ የምትችሉ ካላችሁ continue.
Okay. Now we have covered lung, we have covered cardiac. Let's see hydatid cyst extrapulmonary involvement, which is very important and which was not covered in some other area. It's hydatid cyst extrapulmonary involvement are very rare and can be secondary to hematogenous spread or extension of hepatic, pulmonary, or splenic hydatid cysts. So spleen usually goes to the left side, and lung can give to any part of the heart, and hepatic extension can be to the heart or can be to the lung, to the bone and to the pleura or the diaphragm. Just bone involvement, the overall rate of bone involvement of hydatid cyst has been reported as 0.5 to 4%. Although the spine is the most common location, hydatid cyst in the thoracic cage, including the ribs and the sternum, can also be seen. So here is a picture I want to show you, and here there is a distal part. Middle distal part of the sternum has been involved by the hydatid cyst, and you can see soft tissue density here, and extra just soft tissue has been detected. So this is proven to be hydatid cyst of the bone. Here you can see the vertebrae there is a lytic destructive lesions of the left part of the bone with soft tissue density. So differential diagnosis can be many, but hydatid shall be removed. This is a proven case of hydatid cyst of the bone. This one, a little bit, the screen has covered. This is a ribs hydatid cyst. I'm sorry. I will show you by minimizing the pictures. So chest walls and the soft tissue involvement. The frequency of primary soft tissue involvement is this percent. Isolated muscular hydatid cyst is very, very rare. muscular involvement is usually seen with extension from other organs. The growth of hydatid within the muscle is difficult because of the muscle contractility, and muscle has produced lactic acid. So this is a prevention. So there is no too much muscle hydatid, but this extension from other can go to the muscle. Let's see this gentle guy from postural area. He came with a right, left upper bulge, and it was thought this chondrosarcoma or malignant chest wall tumor, but finally the CT showed soft tissue attenuating, mass extended from thorax to extrathorax involvement. So this is a part you can see. So this is left chest wall anterior. Here is the chest wall soft tissue again. Here you can see paraspinal muscle with soft tissue attenuation, and sometimes it's confused with tumor of the soft tissue. And here is also left axillary mass, supposed to be other, but it was found to be soft tissue hydatid cyst. Here is well-defined right axillary. By the way, these are not the same patient, these are different patients. So just to show you, just all the soft tissue hydatid. So this is, you can see the classic sign of hydatid here. You can see here there is lymphadenopathy. It looks hydatid, but this is a patient with lung CA metastasis to the axilla. You can, this is a differential diagnosis, can be hydatid, but it's proven case of other metastasis. Here is left posterior. This patient has no symptom, and an old man came incidentally with chest X-rays. Chest X-rays are soft tissue nodule in the left upper chest. So CT was ordered. You can see well-defined fluid attenuating, minimal enhancing mass in the soft tissue posterior chest wall. Pleural cavity and the fissures are rarely involved, but they are not exempted from the disease, usually due to rupture of pulmonary hydatids, occasional primary to pulmonary extension. Pleural cavity hydatids causes pleural effusion, hydropneumothorax, simple and attention pneumothorax, and empyema due to infection. So these are, so as a differential diagnosis of pleural hydatids should include, these are the empyema, dermatitis, the mesothelioma, synovial sarcoma, bronchogenic cyst, lymphoma, and the pleural metastasis should be considered. Here is another one in which this is a patient who came with chest pain, and you can see multiple pleural-based nodule with water density ultrasound showed. So this is a case of pleural hydatid cyst. Here is another one. That is well-defined, enhancing. The enhancement is another small cysts. So this is a pleural hydatid. This is a fissural hydatid, and this is pleural hydatid. Diaphragm is not exempted from also, although it is not common for hydatid cyst to be located in the diaphragm. It cannot be exempted, caused by extension of hepatic or pulmonary hydatid. It can come from lung or it can come from the liver. Transdiaphragmatic migration of hydatid from the posterior segment of the right liver lobe has been reported to be more common complication because of the proximity to the diaphragm. So let's see that some of the pictures in which the patient has no liver, but there is hypodense, rim enhancing, membrane mass on the right border of hemidiaphragm, in which the diaphragm has been injured, and there is a mass in the paradiaphragmatic area. This is proven case of hydatid of the diaphragm. Another patient, not the same patient, you can get huge cysts in the right hemidiaphragm, and is proven case of hydatid cyst of diaphragm. Mediastinal also is involved. It is very low, and you can get a lot of masses in the. This is a hydatid cyst in the mediastinum, left upper mediastinum. This hydatid cyst is anterior mediastinum, and here is a little bit lower. Here also there is a huge mass with calcification in para-aortic arch, which can have some ulceration to the aorta, and it has been there for a long time. You can see the fat proliferation. So this is a mediastinal hydatid. Vertebra and the paravertebra also is a common site. Study showed that thoracic vertebrae were involved in 60%. Lumbosacral vertebrae is 35%. Cervical vertebrae in 5 of the cases. So like thoracolumbar, remember, like TB is common in thoracolumbar area, thoracic, and that is common in thoracolumbar area. So if you combine the two, it is very high. Cervical contributes the highest, followed by lumbosacral. Cervical, thoracic is the highest, sorry, cervical is the lowest. Let's see some of the pictures. This patient developed paraplegia and came with a huge mass around the vertebrae, thoracic. You can see there is a collapse and there is a cyst extending in the disc space, and here is also another one, the same patient. This is T2 and T1, this post-contrast T2. So you can see huge soft tissue with vertebral destruction. The patient progressively developed paraplegic and paralyzed, and he was operated. And this is a preoperative. X-ray and post-operative X-ray. This amount of vesicles have been removed from this one. The other one, the one in the middle, is also another patient in which paravertebral soft tissue with extension and the destruction of the adjacent bones. This can be differential, done can be for neurologists, can be a lot like schwannoma and so on. So you can mention a lot of differential diagnosis. So anybody, I covered every part of the body. The hydatid cyst can involve any part, but depending on the lung, the liver, the heart, the heart, mediastinum, sternum, and so on will be involved too. So radiologists should conclusion, the lung are the second most frequent location of hematogenous spread of hydatid cyst in adults, probably the most common location in children because of the spongy of the nature of the lung. In addition to pulmonary hydatid cyst may develop in any extrapulmonary region, including the chest wall, pleural cavity, fissure, diaphragm, mediastinum, heart, and the vascular structures. As symptoms are non-specific, imaging play a crucial role in the diagnosis of hydatid cyst in common pulmonary and uncommon extrapulmonary locations. So the radiologist should be aware of this all. Imaging can also show complications and extension of hydatid cyst. A good knowledge of imaging findings in differential diagnosis of hydatid cyst will enable early diagnosis and guide the treatment management. So home tech measure is any chest mass in endemic area like here, Kenya. If you are from Masaya area, hydatid cyst shall be considered as differential diagnosis. Complicated hydatid cyst usually is diagnostic challenge. It mimics from lung abscess to advanced lung CA, so be aware if the patient is young, if you are unusually huge masses, you can, if he's coming from the pastoralized area, endemic, like in our circumstance from Afar or Somali region or Oromia, you should suspect hydatid cyst. So I finished my presentation. These are the references. It's a lot I can post for you. And thank you to listen. If you have any question, I'm really ready to try to answer. Thank you.
Thank you.
Hello.
Hello, thank you, Dr. Amir. Dr. Brook, please unmute all. Anyone who has got question, please.
What did we do? Thank you. Exclamation point. Mohammed hasn't did that. Do a double one. ليلى ولا تجلسوا.
If there is anything you want to raise, please give us on the chat box. Since there is any disturbance, we can't unmute everyone. I think we are not having any question here. So I am really grateful for Dr. Amir. You are by the side of us whenever we needed you, as usual. በጣም ደስ የሚል presentation ስላደረክልን በጣም እናመሰግናለን. In the name of the members. So all of you, please don't leave. I will give you the link for the question. So all of you, please click this link on the chat box and answer all the questions given. As I said, answering at least 50% of these questions is mandatory to get your CEU points. Otherwise, certificates will not be given.
Sorry, Masfini, where is the link? we can
Chat
still
box.
see Dr. Okay.
chat box ላይ
ماشي.
ቻት ቦክስ ላይ ያለውን ሊንክ ክሊክ ስታደርጉት ጥያቄዎች ይመጣሉ።
ፕሮግራሙ ከሰዓት በኋላ
ከሰዓትም አለ
ከ7 ሰዓት ተኩል ጀምሮ እስከ 9 ሰዓት
አይ ምንም እንኳን ችግር የለም እንደዚህ ከፍቶ ተማረክ
የለም
አሁን ይኸውልህ አንተ ተከታተለው እኔ ልከታተለው አቤት ተከታተለው
ፕሊዝ